Cardiopulmonary bypass is necessary. 2 venous tubes are placed for the bypass machine, one draining the superior caval vein and the one draining the inferior caval vein. Cardiopulmonary bypass is discontinued when heart function is restored. Repair atrial septal defect, secundum, with cardiopulmonary bypass, with or without patch. The right atrium is opened and the size and location of the arterial septal defect are assessed. If it is small enough or if the atrial septal tissue is sufficiently redundant, the defect is closed primarily with suture. If not, a patch of pericardium or Dacron is sewn to the edge of the defect to close it. Repair of atrial septal defect and ventricular septal defect, with direct or patch closure. The right atrium is opened. All dead heart muscles is cut out and the ventricular septal defect is closed with a patch of Dacron or pericardium. The hole in the atrium and ventricle is closed. Complete atrioventricular canal defect, CAVC. Complete atrioventricular canal, CAVC, is a severe congenital heart disease in which there is a large hole in the tissue, the septum, that separates the left and right sides of the heart. The hole is in the center of the heart, where the upper chambers, the atria, and the lower chambers, the ventricles, meet. Repair of incomplete or partial atrioventricular canal, ostium primum atrial septal defect, with or without atrioventricular valve repair. Repair of intermediate or transitional atrioventricular canal, with or without atrioventricular valve repair. Repair of complete atrioventricular canal, with or without prosthetic valve. The right atrium is opened. A division in the anterior leaflet of the mitral valve is closed with the interrupted sutures. The ventricular septal defect patch is placed. The arterial septal defect is closed with a patch of Dacron or pericardium. The right atrium is closed and pulmonary bypass discontinued after heart function is restored. Tetralogy of fallot, TOF. Tetralogy of fallot is a congenital heart defect. It has 4 characteristics. Ventricular septal defect, VSD, a hole between the 2 ventricles of the heart. Overriding aorta, the aorta is on top of both ventricles, instead of just the left ventricle. Pulmonary stenosis, a narrowing of the pulmonary valve. Hypertrophy, the right ventricle becomes thicker and more muscular than normal. Complete repair tetralogy of fallot without pulmonary atresia. With transannular patch. A longitudinal incision is made in the paw and carried proximally across the pulmonary valve annulus and onto the muscles of the right ventricular outflow tract. Infundibular muscle is removed if necessary. The defect is closed with a patch of pericardium. Complete repair tetralogy of fallot with pulmonary atresia including construction of conduit from right ventricle to pulmonary artery and closure of ventricular septal defect. A hole is made in the right ventricle and any muscular obstruction in the outflow tract of the right ventricle is removed. The pulmonary artery or its branches are opened longitudinally until normal-sized vessels are encountered. The ventricular septal defect is closed. An aortic graft from an organ donor is trimmed to form a patch over the opened pulmonary artery. Any excess artery from the donor graft or a patch of pericardium or Dacron is sewn to the graft below the valve to use as a secondary patch for closing the hole in the right ventricle. The graft valve becomes the new pulmonary valve. After the patches and graft are sewn in place and heart function returns, cardiopulmonary bypass is stopped. Banding of pulmonary artery. Cardiopulmonary bypass is not required. The pulmonary artery is exposed through a median sternotomy or left thoracotomy. A band of heavy Dacron suture or tape is placed around the base of the pulmonary artery. Once the paw pressure distal to the band is less than half of the systemic pressure and the patient's arterial saturation is greater than 70%, the band is tight enough, but not too tight. The incision is closed.